We are here at Golf Zone Social in Scarsdale, New York, and we're joined by Dr. Michael Schwartz, who is an orthopedic surgeon and sports medicine specialist. And thank you so much for joining us here today. We're getting ready for the golf season, and some people, they need this, right? They need to get themselves prepared, physically prepared.
Having a comprehensive stretching and strengthening program in the off season can be very beneficial.
So what are the most common things that you see injury-wise in people? Is it shoulders? Is it back? Is it legs? What is it?
You started with shoulders, absolutely. We see a lot of that. There's a lot of important tendons in the shoulder, and this is the age group where we're very susceptible to tendon injuries, particularly some overuse injuries. So I definitely see a lot of rotator cuff tendon issues, as well as some of the upper biceps tendon, very common in golfers and really athletes and active people in all activity.
How are things different depending on age?
That age demographic, 40s to 50s, we're very susceptible to tendon injuries. Consistently, we'll see tendons that have some wear to it. That may not be bothering someone, but there are some people, particularly active people, they're going to feel that. There are tendons throughout our bodies. We're using them in all of these activities, especially golf. And so I see a lot of what we call tendinopathies of various joints.
An athlete's mentality is to play through the pain, right? So you feel something in your shoulder and your back, it's a little tweak, and you want to keep going through it. How important is it to not do that?
We were designed to have a pain response when there's a problem. So we should listen to our bodies. It's not that we have to get it evaluated right away. It's reasonable to give aches, pains, strains a week or so, but anything past that that's not getting better or getting worse, then we should have it evaluated.
So what are some of the alternatives to surgery that White Plains Hospital can offer to golfers?
So we have a range of options at White Plains Hospital. It can start with things as a brief course of some medications, and often we're going to be working in some physical therapy as part of the treatment regimen. If we need to do more than that, we have options such as various injection options, cortisone injections, which there's a lot of pros and cons with that. So definitely I'll say we want to limit those, but there's more modern biologic options such as what's called PRP or platelet-rich plasma. We often partner with our pain management specialists, as also part of White Plains Hospital, where they have an array of treatment modalities. Between all of that, we have a very high success rate. We've set up our practice at White Plains Hospital where we have all the specialists and subspecialists. So if you call our general number, we can point you in the right direction to ensure we address whatever the injury is.